Okay, come to the next speaker. A very warm welcome, Julian. Nice to have you here. So good. You are an international and global milk banking expert and specialist in many ways. Yes, I say so. And you were a the founder member of EMBA and president of EMBA, and you are the founder member of the Human Milk Bank Foundation together with Natalie. We heard her tomorrow, and a founder member of GAMBA. We will hear now, so everybody knows you.
Es ist mir eine große Freude, heute hier zu sein. Danke an die Organisatoren, die FMBI, für die Einladung und danke an euch, dass ihr mein schreckliches Deutsch toleriert. I'm embarrassed. Your English is so good. My German is so terrible. But I thank you for allowing me to speak in English, which I'm a little bit better at. I'm going to share some experiences across the globe. But I do have some conflicts of interest. I work in the field of human milk banking now for 33 years. My son was a baby and he's about to be 34. And I'm not impartial here. I believe absolutely implicitly in the value of the work of human milk banks and the appropriate use of donor human milk. But I've also worked for some organizations, PATH and Alive and Thrive, and I will be talking about some of the resources that they produce. I'm also a consultant, excitingly, to Sprite, which is the drone company, and I'm helping them develop the use of drones for transporting human milk, for transporting blood, tissue, cells, medications. It's very exciting. So those are my conflicts. Our global mission, all of us, is to promote and support breastfeeding. And we want to do that by providing safe and high quality, optimal quality donor milk to address gaps among those who would not otherwise have access. So we can think of, as Anne showed the photograph, donor milk as a bridge to breastfeeding, and in the most frequently, that is how it's used, for hopefully a few feeds, a few days, sometimes a few weeks, until the mother is able to provide enough of her own milk and eventually to breastfeed. So mostly it's a bridge, but sometimes it is the infant's only opportunity to receive donor human milk or to receive human milk. And that was one of the things that drove the work that Natalie and I have been undertaking in the UK. I want to mention this toolkit. Some of you will be familiar with it. I hope you will all go away and check it out because it's a resource toolkit. It comprises a number of tools, resources to help anyone and everyone that has any interest in human milk banking. So please, it's free to download from PATH, and it contains a wealth of experience and information to help you with monitoring, with evaluation, with HACCP, with supporting bereaved donors, a whole series of different tools. It also includes this map. It's an interactive map. It contains the details of all of the milk banks that have been submitted, that have submitted their information. So do please visit it. If your milk bank isn't on there, you can submit the information, the contact details, and you will be added to the global, the whole joined up global world of milk banks. Globally, there were 760 at least human milk banks in 70 countries. The numbers are growing. The numbers are growing quite rapidly. There are quite a lot of new countries that are opening their first milk banks. They're A lot of the work I've been doing over the last 6 years is with countries that are establishing their first milk bank. And it's estimated that those milk banks around the world, that together we feed at least 800,000 infants. So this isn't a sort of minority action that's going on. There are a lot of babies receiving donor human milk from the milk banks. The link there is directly to the interactive map. So, as everybody knows, the World Health Organization recommends donor human milk for preterm and low birth weight infants, but also for sick newborns who cannot be fed their own mother's milk. And as Natalie mentioned last week, the recommendations for the care of the preterm or low birth weight infant were published. And in it, it specifically states that if a mother's own milk is not available, then donor human milk should be given whenever possible. So it's there as a recommendation from the World Health Organization, but there are no global guidelines available on how to establish, how to operate milk banks. There are no global minimum standards either. There are lots of guidelines around the world from many countries that operate milk banks. Interestingly, the recommendations can differ quite considerably between the national and the international guidelines. According to history, according to economics, according to locality, culture, and so on. So there are certainly differences. And what's very important for anybody that is faced with setting up a new milk bank in a new location is not to try and mix and match recommendations from different sets of guidelines, because a guideline should really be taken as a whole. And unfortunately, what tends to happen is that because there are different recommendations, different ones get adopted. I'm quoting here a paper that there's no global coordinating body that issues minimum quality, safety and ethical standards to inform national policies on donor human milk. So milk banks need to adapt to restrictions, local restrictions, resources and needs, and they need to apply processes to provide safe and high quality donor milk. So that was published last year. However, happily, WHO has now undertaken to develop and to publish guidelines. They're in the preparation stage now. The meetings are starting very soon, in a couple of weeks. It's been approved. They've been approved as a technical product, and they should be available hopefully by the end of next year. So there will be global guidance, which will make a big difference to many countries around the world that have no history, no culture of milk banking. Now, I had hoped to be able to take you on a very fast flight around the whole globe so that I could introduce you to some of the really fascinating aspects of milk time now. What I do hope to do is to record a longer version of this talk, and it will be available to look at on the Human Milk Foundation website. So if you're interested in what they do in Brazil or India or the Philippines or wherever, then bear with us. Natalie and I are very keen to put all our presentations onto the website to be freely available. But I'm just going to concentrate on our home continent of Europe, and I'm going to start with the United Kingdom. I'll let you into a little secret. We're not that united for various reasons. But underneath it, we love each other. And there are currently 14 human milk banks. But interestingly, Scotland has one nationwide facility. So there's one milk bank. It's based in Glasgow. It recruits donors from the whole of Scotland, and it provides donor milk to all of the neonatal units in Scotland. It's funded by them all. It acts as a national resource. The same is true of Northern Ireland. except that they also recruit donors from the Republic of Ireland to the south as well, and they provide milk to hospitals in the south. Now, having one facility means that everything can be streamlined and you know exactly what is happening because there's only one source of milk. It does become a problem if there's a difficulty and if for any reason the milk bank can't operate. And that did happen to the milk bank in Northern Ireland through no fault of their own. There was a question mark over the water supply, and it meant that the milk bank had to close, and it was closed for many months. And of course it meant that suddenly all of those hospitals throughout the whole country no longer had access to donor milk, even though their feeding protocols, their neonatal unit guidelines were expecting everybody to use it. Fortunately, some of the milk banks in England were able to put milk. I was taking milk myself to Heathrow to put it on the plane to send over. It's a bit too far for drones, and milk was going on ferries across from Liverpool and so on. But it is a cautionary tale that too few milk banks can be problematic. England is very different. We have 14 milk banks, but there's no regional service, no national service, there's no equity of access. And that was one of the problems that Natalie and I wanted to help to address. And in Wales, there are no milk banks at all. There's a national association similar to FMBE. It's the UK Association for Milk Banking. Their website can give you more information about all of the milk banks. So at the Human Milk Foundation, we incorporate the Hearts Milk Bank, and the Hearts Milk Bank is an independent milk bank. So it's very different from all the other milk banks. I managed a hospital-based milk bank for 27 years and lived with the joys of that and the joys of being involved and working on the neonatal unit and with all the local families. But I also lived with the difficulties of working within a hospital setup with its financial constraints, with its layers of management and tiers of challenges to overcome in order to be able to sustain and to grow a service. Natalie and I wanted to be able to make donor milk available in an assured way to any hospital that wanted to use it that didn't have access, so that they knew that when they picked up the phone that the answer would be yes. And so far it has been. We provide milk to over 50 different hospitals, as well as to very many families in the community. So far, 500 families in the community where the mother is extremely ill, where there are challenges of one sort or another to be able to support those families. And I won't talk more because Natalie covered this this morning, other than to say, do please visit our website and look at some of the videos and some of the testimonies from families, particularly families in the community. We all know from our experience how helpful donor milk can be for families on neonatal intensive care units, but it can be equally helpful in ensuring that babies can receive human milk, but that mothers can be supported to lactate and breastfeed. We have various methods of transport. We don't just have the fancy new electric car delivered yesterday. We started off with a little smart car that's beautiful. Motorcyclists got together in groups to be able to support the NHS, all our hospitals, with the delivery of blood, sets of notes, emergency surgical equipment, whatever that might be needed out of normal hours in an emergency. So baby's transferring suddenly and something needs to go to another hospital that hasn't gone with the baby, whatever. And they call themselves the blood bikes. They're all volunteers. They all go out and respond to the call as it comes. There are very many of these groups. They all look a bit like this. Some of them have very fancy wrapped bikes. Others ride their own bikes, but they're a very well-known part of the service. Around 10 years ago, 12 years ago, I was asked if they could help to support donor human milk banks by transporting milk? And of course, the answer was, wow, amazing, because we were spending a lot of money on couriering milk. And it was also one of the reasons why we weren't able to recruit donors who lived too far away, or indeed supply milk to hospitals. Bikes can get through traffic much faster, even faster than your pedal bikes in Freiburg. And so they absolutely revolutionized milk banking in the UK. And everything free of charge. They run as charities, and they support it all free of charge. And we also have volunteers who drive the cars too. So I think of them as the milk bikes, because now actually they transport as much milk as they do blood. We'd love them all to have human milk. They do have boxes that have donor human milk and precious product on board and things on them. So it's a great way of telling the whole population that human milk is on the move. But looking to the future, milk banking is expanding everywhere, and we can't guarantee that the blood bikes, the milk bikes, will be able to continue to grow. We know that there's a report going to be issued in the new year from BAPM, which is the British Association of Perinatal Medicine, that will support the wider use of donor milk, much wider than it's used currently in hospitals. So we're expecting the demand and the need to grow. So we're always looking to the future. This is a drone. If you wonder what they look like, this is what we're thinking, and we're looking to test very soon over the hills of Wales and up in Northumberland. It's a wingcopter, and they're made in Germany. Where else? Where else you go for technology? I very much hope to be the first person to be putting donor milk into a drone and waving it goodbye, but I will accept a challenge if anybody would like to take me up on that and move things faster in Germany or Norway, where there have been lots of discussions also. Seriously, it's coming. It's coming in the field of the transportation of a whole range of substances of human origin. So it's going to happen, and I'm looking forward to it. A new toy. So the European Milk Bank Association that Corinna mentioned, founded in 2010, there are 281 human milk banks in 28 countries in Europe. So this is not a niche activity that we're involved in here. It's increased since 2010 from 150. Now, some of those were actually operating, but were a little bit secret. And this term secret milk banks I coined from Corinna, who first coined it at one of our conferences. Some of them were operating sort of under the radar, but I think everybody's come out in the open now. So we know that there are at least 281, with more in development. I won't take you through the history because of time, but what I will do is say that there are milk banks planned in Georgia, Turkey, and Latvia. Anne's going to be talking to colleagues in Riga about setting up the first milk bank in Latvia. And last week I was in Tbilisi in Georgia, which is a beautiful city. If you want somewhere nice to go, I recommend it. But to find out more about the work of the European Milk Bank Association, the website is here. You can click on any of these maps, or there's a full map that you can click on the country, and you can find out where the milk banks are, what the contact details are, a little bit about whether they have guidelines, whether they have a national association, what's happening. It's a good place to go for information about the congresses and the research meetings. The next congress is in Madrid next October. So you can have a meeting here in September and then Madrid in October. And we also have research meetings every other year. One of the things that we did fairly recently that I'd like to tell you about is to say that we put together a whole group of stories from across the whole of Europe. And these were stories about families and babies that had received donor milk. Some of them were very classical, very preterm, very tiny babies. Some had necrotizing enterocolitis, the sort of babies that you're caring for all the time. Others were very different. They were older babies, bigger babies, sometimes babies that needed donor milk for many months. A whole range of stories. It was put together into a book, and you can access the book and read the digital version of it. So do please. And it was very much publicised, and we had hundreds of thousands of followers on, people coming to look and read the stories on Twitter and Facebook, and so on. So everybody probably remembers first thinking about how COVID-19 was going to impact us on neonatal units and in milk banks. What was going to happen? How was it going to disrupt our services? Were milk banks going to close in huge numbers like they did in response to when HIV became known in the 1980s? And it was very clear to me that all of the challenges that we were thinking about and facing, how were we going to get mums to get their bloods tested? Were we going to be able to accept milk? How could we go to people's houses? What about the motorcyclists? Was it safe to send them to someone's home to pick up donor milk? I realised that everybody was facing these challenges. So I got out my address book. I've been very fortunate to meet so many people working around the world in human milk banking over so very many long years, that started a virtual group. We call it the GAMBA, the Global Alliance of Milk Banks and Associations. There are 120 members. I think there's at least maybe 8 members here in this room today, from 40 different countries. And it's a means by which everybody can share information, they can share questions and get answers, they can publicise meetings that are happening, and so on. We're working towards it becoming a much more widely accessed resource for all. At the moment, it's a WhatsApp group, and so we're limited by the numbers of people that can be members. But I'm getting very kind offers from people in this room to help make it cloud-based, and to be able to increase, because he's got nothing else to do, as we know. He's not even listening, and to be able to increase the membership, but also to be able to do things like bring together all the guidelines, to be able to, so that everybody can have access to them, to be able to put together a really excellent archive of milk banking materials and so on. So it's also a great way of bringing everyone together to celebrate World Day of Human Milk Donation, which is on the 19th of May every year. It's a fantastic way of celebrating the gift of breast milk globally. So that I'm not going to try. I'm not going to try again. I'll say danke, and happy to receive questions.
Thank you so much, Julian. Your work is so amazing, and your plans. So what will be the next step with GAMBA?
With GAMBA, so what we want to do is to make it more freely accessible. The difficulty is at the moment it's a virtual group with no funding. What we have been able to do is to really identify who are willing to help us, to those people who do some of the work. So that's already happened, to be able to establish how best to work together, but it's also been able to support this work that's being done by the World Health Organization, and the World Health Organization is very keen to be able to, collaborate much more widely with milk banks around the world, with people working in milk banks. It's a very easy way to get people's reactions. We've already done various surveys. We've looked at surveying all of the members about their experiences with the for-profit section of the human milk, so the human milk industry side of things, what products they're familiar with, are available, and so on. So we're able to do that, and that's been written up and is going to be submitted very soon. But it means we can look at any aspect and very quickly get. So if you have a question, you can ask Daniel or Corinna or Rudy, some others, and get it posted. And if you have a burning desire to be on there, then we can add you to the group as well. But it'll be much easier when it's in a different format. WhatsApp isn't ideal, but it was something we could do very quickly. Wonderfully, within 2 months of initiating the group, we had a paper published in Lancet, which brought together experiences to do with COVID and responses to COVID from all around the world.
This was very quick. Yes. Gibt es noch Fragen hier aus dem Publikum? Ich denke, eine Frage können wir noch zulassen oder aus dem Chat.
It's lunchtime.
So the chat people say thank you.
It's my pleasure. It's lovely. Thank you.
Wir haben die ganze Zeit wieder aufgeholt, fast, sodass wir die Mittagspause pünktlich um 13:45 Uhr beenden können. Guten Appetit.